Triple-negative breast cancer, we now know, it's a heterogeneous group of tumours. There are multiple subgroups. And what this research really tries to do is try to stratify response to drugs, specifically CDK4/6 inhibitors, according to their subtype. So in this research, I'm particularly focusing on the luminal androgen receptor subtype. We have found a subgroup of triple-negative breast cancer, in this case luminal androgen receptor subtype, which is particularly sensitive to CDK4/6 inhibition in preclinical studies. And what we have shown is that the sensitivity level is very similar to that we observe in the ER-positive breast cancer models. The clinical implications are very exciting. So we've validated the work in mouse models, and now what we have done is we have set up a phase 1b clinical trial, which is called PIPA, running at the Royal Marsden Hospital and other sites in the UK. And what we're doing is we are now selecting triple-negative breast cancer patients with PIK3CA mutations, and we are offering them a combination of a CDK4/6 inhibitor and a PI3 kinase inhibitor, which reflects the work that we've done in the preclinical models. I think it's a very exciting time for breast cancer. I think there are multiple exciting drugs coming through. I think there's a lot of excitement and enthusiasm towards trying to look at particularly immunotherapeutic agents in breast cancer. And I think what we're trying very hard to do in the lab is trying to find particular molecular features or mutational profiles and trying to match them to targeted agents. I think it looks like it's going to move towards combination, and also what we're trying to do as a community of oncologists is trying to work out where these combinations fit in the treatment management plan. I think the most important message really is, at this moment in time, is that it looks very exciting, CDK4/6 inhibitors, but obviously this needs to be validated in patients. So I think we can learn a lot from preclinical work, and I think if our experiments are designed well, then hopefully we should see some responses in patients.